Ladies and gentlemen, welcome to our podcast at MedSynapse, a leading platform dedicated to knowledge exchange, fostering collaboration and innovation in the medical field. Join us as we explore captivating discussions and insightful interviews with renowned experts, all brought to you by MedSynapse. Today, we have the pleasure of introducing a highly accomplished medical professional, Dr. Basima Jaber, a consultant obstetrician and gynecologist at Emirates Specialty Hospital in Dubai. With an impressive educational background, Dr. Basima completed her MD and Master's degree in obstetrics and gynecology from Damascus University. She holds the esteemed board certification from Jordanian Medical Council, solidifying her expertise in this field. With more than 35 years of experience, Dr. Basima has established herself as a trusted authority in all aspects of obstetrics and gynecology. Dr. Basima is not only a dedicated clinician, but she also has an active presence in the digital world. She's active on various platforms such as YouTube, LinkedIn, and TikTok to educate and raise awareness among patients. Her commitment to patient education extends beyond her professional obligations as she generously dedicates her free time to share valuable information. With strong focus on pregnancy care, surgical procedures, and women's reproductive health, Dr. Basima has earned a reputation for providing exceptional care in these areas. Notably, she has a unique background, having initially trained in pediatrics before specializing in obstetrics and gynecology. Dr. Basima's thirst for knowledge is very evident as she has earned diploma in aesthetics from prestigious American Academy and a diploma in IVF from Cairo, Egypt. Dr. Basima is also certified breastfeeding consultant, further demonstrating her commitment to comprehensive care for her patients. Welcome, Dr. Basima.
Thank you very much. I'm so happy, so pleasure to meeting you. Thank you very much.
Thank you so much for joining us on our podcast today. Today's discussion will focus on insulin resistance and its impact on women's health. Before we begin, I would like to ask one question, as I'm very curious about the shift in your medical career. Could you share with us what led you shift your career from pediatrics training to specializing in obstetrics and gynecology?
Okay, it was a long story actually. Before I started my journey in pediatrics, because I started also my family. So what happened during my journey, I'm working in a hospital which is gynecology hospital, and sometimes gynecology doctors selfish to refuse to do consultation from pediatric doctor for their baby. So I decided to take the baby from abdominal of his mother and examine him. Actually, sometimes you face difficulty in your life, but this difficulty comes from the God. This is to make you more stronger. That's why I decided to start my new journey, and it was a difficult journey, but it was interesting because I feel happy when I give other human. This is my personality. That's why I take another specialty and try to take the board, and every day I try to get some new information. And I said to myself, oh my God, this information is really new for me. I will pass away without knowing this information. There is a lot of information. Every day there is a lot of research. Every day we have learned something. And this is make me feel that I am fresh student. I really want to learn again and again. And also my journey, I want to make medicine and education. Medicine is like popular for everybody. That's why I'm ready to answer a lot of emails from other countries. And يعني I am Syrian and our female suffer a lot these bad years. And some female in Germany, some female in America, and they don't know how to reach the doctor. So when they ask me, I'm ready to help them. I'm ready to make simple education for medicine to make everybody know a lot of things يعني I want to help the female. That is my يعني my hope.
Now let's move on to the questions related to our topic. The first question, could you please explain what is insulin resistance and how it relates to field of obstetrics and gynecology?
Okay. Before I speak about insulin resistance, I will speaking about insulin. Insulin is a hormone secretion from beta cells in pancreas. And the role of insulin is very important because this hormone could transfer glucose to energy. And brain, liver, muscles need glucose to get energy. What happened in insulin resistance, we don't know why it is happened, but there is a lot of risk factors. What happened, there is no, resistance means insulin couldn't work probably. Actually, there is a lot of risk factors. Why resistance of insulin happened to Ahmed and not happen to others. Sometimes genetic problem is a one important risk. Like mother, father, grandfather have diabetes type 2, and sometimes if obese, if there is a lot of fat. Sometimes our work now, we are working in group. 12 hours we are not doing exercise. Also what we eat a lot of fast food and we eat a lot of carbohydrate, a lot of sweet. All these things make this problem is very common. And what is dangerous now, that resistance of insulin happens even between children. We have this problem even between children. Before we face type 1 diabetes between the children, only because immunization problem and there is no insulin at all. But now even diabetes type 2 have happened for children even. So resistance of insulin is something we don't know why it is happening, and it is misdiagnosis, but we have to try to diagnose it early because these cases, even it is dangerous and there is a lot of complication because of it, but we can deal with it and it is reversible. If we diagnose it early, if we change our lifestyle, if we know what we eat and how, when we eat and what exercise will help us, we avoid a lot of complications.
That was a fantastic explanation. Thank you so much, Dr. Bassima. Now let's move on to our next question. What are the common risk factors associated with insulin resistance in women?
Okay. First things, as I told you, genetic risk factor. Sometimes we born with family, father, mother, grandmother have diabetes. This is genetic problem, but we can, even with genetic problem, we can avoid this big problem. And obese, as I told you, if we have more fat, actually there is a close circle between resistance of insulin and fat. If we have resistance of insulin, insulin makes fat come more and more. And if we have fat, we have resistance of insulin. If we have deficiency on vitamin D, Vitamin D is very, very important vitamin. It is not only vitamin, it's hormone, my dear. And now we are يعني يعني like common problem. Because why? Because we are not even in the يعني like Al-Imarat, there is a lot of sun, but we couldn't face sun. We are working in our office, living in our home. So without sun, we couldn't create enough quantity of vitamin D. So vitamin D deficiency, and if we are not doing any exercise, and age also. يعني after 40, we have faced this problem also. We have to know if we have this problem by a test to check and to taking like good decision to change our lifestyle.
Thank you, doctor, for outlining the common risk factors associated with insulin resistance. Now, moving on to the next question. How does insulin resistance impact fertility and reproductive health in women?
This is very important question. Actually, insulin, يعني resistance of insulin means يعني always I told my patient insulin is like a key, and there is a lock on the cells. The key must work on the lock. Sometimes a receptor on the wall of the cells refuse to make insulin enter to the cells. Actually, this makes insulin out cells. In the same time, cells require more insulin because she wants to get energy. So what cells doing? Send again signal to the pancreas. Please send to us pancreas. Send to us again insulin. And pancreas also send insulin. That is why what happens in insulin resistance, the problem is not in the level of glucose. Problem is in increase in the level of fasting insulin. But this insulin is not work. Only do problem. Do problem how? Actually, for fertility, insulin is good problem for fertility because by insulin there is increase in androgen. What is androgen? Androgen is male hormone, which is supposed to be not increased in female because it is toxic and it will be cause still to ovulation. There is no ovulation if we have increase in androgen. That's why 70% of women with resistance of insulin suffering from polycystic ovary. What is polycystic ovary? This is a syndrome. There is 3 symptoms. If 2 symptoms available, that means we have polycystic ovary. Polycystic ovary means irregular menses. Sometimes menses come every 3 months, 1 time, or every month, 2 times, and heavy period. Why heavy period? Because there is no ovulation. Why ovulation is important? Because we have 2 phases in our period. First phase, first 14 days, there is increase in estrogen, which makes endometrial thickness. And in the day of 14, if the period is 28 days, ovulation happens. And in the same sac of ovulation, which of egg come out, create luteal cyst. This luteal cyst is secretion progesterone. And the role of progesterone is to make this endometrial ready to implantation of eggs if pregnancy happens. And if pregnancy not happen, progesterone will make endometrial less thickness. That's why period come only 3 or 4 days. But what happens with polycystic ovary female, they suffering sometimes from heavy period because there is estrogen and there is no progesterone. Like what happens if we have ice too much, and when sun comes, this ice will come together. That's why we suffering from heavy period for long time, more than 10 days, and a lot of them have also hyperplasia, a problem, maybe candidate to take cancer in the uterus. That is what happens if we have androgen before and no ovulation happens. Because, as I told you, there is an imbalance in insulin and increase in androgen. Other things cause infertility also. You know what? Because insulin decrease sex hormone. Sex hormone who's carry androgen, who's carry male hormone. That means we have more free testosterone, which must be only 1% in female. When we have increase in testosterone, in androgen, we have acne, we have hirsutism. You see female with hirsutism here in the side, which must be only for male. This causes a lot of problems. Also, we have pigmentation in the neck, in the back, in the arms. This is a very bad. Also, in 20% we can show this small follicle in the margin of ovary, even one ovary or two ovary. So this is a sign of polycystic ovary, which happens in 70% when we have resistance of insulin. So insulin resistance also, when we have this during pregnancy, usually all pregnant women have ability to get resistance of insulin. It is physiological development.
It's incredible how insulin resistance can have such significant impact on infertility and reproductive health in women. Moving forward, let's talk about gynecological conditions commonly associated with insulin resistance. Are there any specific gynecological conditions or disorders that are commonly associated with insulin resistance?
Of course, we spoke before about polycystic ovary, which is associated with resistance of insulin, 70%. And also we have problem during pregnancy. Miscarriage happens more and more. And also we have risk factor to get gestational diabetes. Of course, this is a very dangerous if we don't deal with it, because when your fetus inside your uterus and there is increase in glucose, that means this fetus is more risky to get diabetes in his future. He is more risky to get obese. He is more risky to get vascular and heart disease. By the way, increased insulin goes also like a chronic inflammatory disease in all the body, also in the basal. That's why they are more candidate to take stroke in the brain. Also to get Alzheimer. You know why? Because we consider diabetes is Alzheimer, we can consider it type 3 of diabetes. Because when we have resistance of insulin, we couldn't remove amyloid, this protein who causes Alzheimer. So, when we saw the complication of insulin resistance, which is we can reversible only by change our lifestyle, by choosing good diet, by getting interrupted fasting, by doing exercise. If we do these 3 steps, we can prevent metabolic syndrome. What is metabolic syndrome? All people with resistance of insulin will go to metabolic syndrome. That means they are more ability to get diabetes, to get hypertension, and to get fatty liver. Usually we know that alcoholic cause fatty liver, but now resistance of insulin cause fatty liver. So we need to make everybody from childhood, we have to fighting this insulin resistance. We have to choose good way for our health, because our health is very precious things which we have to take care of it.
Thank you so much, Dr. Basima, for a very informative answer. Moving forward, can you discuss the potential effects of insulin resistance on pregnancy outcomes and the health to both the mother and the baby?
Yes. First things, when we have insulin resistance and we don't do anything, we shall getting gestational diabetes. And what happened, glucose come through placenta, come to our baby. And insulin, even we get insulin not go through placenta because it's big. It is big, so couldn't go by placenta. What happened? The pancreas of the fetus will active and secretion more and more insulin because we want to decrease the growth. Insulin is like a growth hormone. It goes very big baby. You know what that means? Very big baby is very big problem because when delivery, by normal delivery, a lot of shoulder dystocia happens because there is a lot of fat here and cesarean is more risky, and even with cesarean, we have infection more. So we have to use also a certain tools to get baby, which is very, very bad. And sometimes we lost our fetus if sugar is high and nobody will take care and no diagnosis early. I know one female, every time when she arrived to the month 9, she lost her baby. Also because of sugar. If sugar high, it's very difficult. So, as I told you, more miscarriage, more problem, even if diabetes with woman, gestational diabetes not cause a lot of anomaly problem for the fetus because it happened after month 5. It happened after baby will and everything. But if we have diabetes before and during when eggs implantation, we have to know this is very dangerous. Because it's so high, it will be cause a lot of problem for cardio, problem for baby, a lot of miscarriage, and as I told you, even when baby inside uterus has a lot of glucose, it will be very bad for his future, and it will be anything for his children. So what I told to my patients also, when I discovered that she had gestational diabetes, you have a big responsibility about your baby and your grandchildren also. So we have to educate our patients about this very, very dangerous things. Because there is also change in the vessels. There is more risky to have more thrombosis, more infraction for heart, problem in cardio, problem in vessels, problem in brain. So it is big complication.
So the effect of insulin resistance on both mother and the baby are very concerning, and we should raise awareness about this. It's a very important topic. Thank you so much, Dr. Basima, for your explanation. Now, let's talk about the clinical signs or symptoms that might indicate the presence of insulin resistance. What are some clinical signs or symptoms that may indicate the presence of insulin resistance in women?
As I told you, insulin resistance is like misdiagnosis too much, but we have to think in it. Some sign like pigmentation in neck, in back, in arm, some pigmentation, and also when patients come to me, we have to see tummy circumference. If it is more 40 in male and more inch and more 38 in female, more than 79 centimeters, that means we have to search about resistant of insulin. And we can discover by blood test. Usually I request for fasting sugar and fasting insulin. If fasting sugar is 90 or 100 or whatever, and insulin more than 6, that means we have resistance of insulin. And we have to start to fighting with this bad syndrome to prevent ourselves to take metabolic syndrome and diabetes and hypertension and a lot of big problems. Increased cholesterol, increased triglycerides. This is big problem. And you feel that, diabetes, when anybody gets diabetes, that means he needs all specialty, from his head to his foot. But if we do some exercise, especially weighting exercise, walking is free. You can walking in home even. Try to give yourself only half an hour in the morning. Even you are in your office, you can move your leg in that way, up, down, 15 minutes. They do a new research and they discover that this way, if we are sitting in our office, only moving our finger of the foot, up, down, 15 minutes, you know how much we decrease glucose? We decrease glucose 58% and we decrease insulin 60%, which is easy. We can discuss, we can doing it even we are in the meeting. It is easy way. So we have to do something. We have to read about our dangerous, and we have to discover very, very simple, low carbohydrate. We can get carbohydrate only by vegetable. Some vegetable is very good, and you can get a lot of good things. Let us doing our plate lazim, half of it lazim green salad, and other half we can divide it into 3 parts. One is fat and one protein and one even carbohydrate. We can get sweet potatoes, we can get broccoli, we can get a lot of things. It is with which glycemic index is low. We avoid all juice. Juice is causing a lot of problem. Juice is causing increase in the fructose. It's cause tsunami in the liver. So we have to take care of what we eat, and we have to know what we must eat.
Thank you so much, Dr. Bassima, for your detailed answer and providing us tips on how we can exercise even when we are sitting in the meeting or in the office.
Yes.
Now, moving on to the next question. What diagnostic tests or screening methods do you recommend for identifying insulin resistance in your patients?
Actually, as I told you, we can do fasting sugar, fasting insulin, and there is also some other test which is insurance company not approved. The name is HOMA test, and by HOMA test we can understand not only resistance of insulin available, but what is the degree of resistance of insulin, if it is too much or less, by reading the result. So we have to go and screening about this issue if we have fat around tummy. And this fat is not only about on our tummy, it is also fat in our liver, which is cause a lot of problems. So we have to take care of ourselves. And by the way, resistance of insulin happens even between thin female also. We have to search it. We have to thinking about it. When we have regular period, when we have polycystic ovary, when we have multiple miscarriage, and when we have problem with infertility, we have to do this simple test, I think.
Now, let's shift our focus to available treatment options. What are the treatment options available for managing insulin resistance in women?
Yes. Usually, the doctor will prescribe medication for more sensitive for insulin, like metformin. But we can, by changing lifestyle, finish from this issue. First, we must know what to eat. Second, we must know when we have to eat, like fasting 16 hours. Yani we have to make our breakfast like 11 o'clock and our lunch at 7 o'clock. We can eat only 2 times. No snack. Multiple snack is a risk factor to the resistance of insulin. And we have to sleep well. We have to deal with our stress, my dear. Because the stress causes problem with cortisol, and cortisol makes it cause more. Anything that makes our glucose more is a risk factor to get resistance of insulin.
Dr. Basima, I want to thank you for your expertise, for sharing your insights throughout this interview. Your knowledge and experience in obstetrics and gynecology, particularly regarding insulin resistance, have been truly enlightening to all of us.
Thank you. I will also thank you because this is pleasure to me to make this issue is to make people understand this issue and to try to fight with it. Okay?
Thank you. We're so grateful for your time and effort you put in educating us today.
Thank you for this chance. Thank you very much, my dear.
Thank you, Doctor.
Yeah.
Before we wrap up, I would like to remind all of you about our MedSynapse platform, where you as healthcare professional can actively participate in discussions and connect with our medical experts. If you're looking for a community where you can engage in meaningful conversations about medicine and contribute to the advancement of healthcare, I highly recommend checking out MedSynapse. That's all for today. Until next time, take care and thank you for listening. Goodbye.